infectious diseases, postgraduate medical teaching, medical research methodology, and critical appraisal of medical literature. He has completed his Fellow of the Royal College of Physicians in UK and the IMA Academy of Medical Specialties in 2016. Dr. Sharma has authored a chapter, Algorithmic Approach for the Diagnosis of Polyuria in a textbook, The Medicine Update 2013. He has received a Lifetime Achievement Award from Limbra, Chennai and the Best Doctor Award from Delhi Medical Association. We welcome you, Dr. Sharma.
Thank you so much, Samyukta, for the warm introduction.
We are so happy and excited to gain insights from you today.
Am I audible? Am I well audible?
Yes, sir. You're very much audible. Attendees, please comment in the chat box if you're able to hear Dr. Sharma.
Okay, the presentation slides are also visible, I guess.
Yes, sir. It is very much visible.
Okay.
Attendees?
Okay, shall we start?
Yes, sir, we can.
Okay. Good afternoon, friends. Nice that you all have come here to learn something about what you would like to do probably after you have graduated now, and then what is it that we have. And this talk has been a subject of interest for several universities where we have presented it, and of course I have updated it for your purpose today. Just got MBBS degree. Look at those girls and guys. Look at them and cleanly observe their faces. Okay? So the question mark in their faces, the sort of suspicion, doubt, or enigmatic look, or whatever you call, is there in all of our minds once we finish our graduation, right? So how do we go about that? The career options after MBBS, there are several things: the education, further education, and vision, the skills we acquired, the interest, professional and non-professional, vritti and pravritti interests we have, the values we attach to our profession and to our career, and of course your ultimate goals, all will carve your future. Many options, right? We are going to discuss those things. And what best suits you may not be suitable for your friend. So you have to choose what is suitable to your career, to your taste, to your values, to your goals, and to your vision. That's what we are going to tailor it to you so that you can take a clue from this and then probably go ahead and then chart out the plan. And I'm available. I have given my contact details at the end of the talk. Those of you who would like to contact me, I'll be so much pleased to be with you to help you in deciding if you have a couple of options. So there are many options, some which are very familiar and some which are road less traveled, right? And then many questions, but no clear answers. That's why we are here. So the questions about our future usually are, when I say you, it means me also when I was a young graduate, and sometimes now too. And are you an aspiring MBBS completed student worried about career options after MBBS? Or have you considered questions like PG courses after MBBS, options after MBBS, or even jobs after MBBS? There are a lot of approaches and ways one may go after MBBS, but how to choose the best for you will be unfolded in the next slides. After this presentation, the objective is you will never ask the same question again. And I assure you, dear friends, this will be answered summarily, right? The big question in every MBBS graduate's mind is, will my future be rosy? When we entered medicine, all of us think that we are on the top of the world and we are going to have a very rosy future. What am I up to in my life in the next phase of life? Will I have a job satisfaction that I am going to take up? Will I have to leave my country? When will I start earning my money? This is a big question mark, because your friends who have joined the engineering stream, by the time they're 23 years, they're already earning a good salary packet. And we are still asking my father, your father, or whoever it is, the parent, to send the money. So I know getting MBBS to hand means just a beginning. I also know the completion is really tough. The competition is really tough hereafter. And today, I have to be prepared for consumerism and violence too. When we were graduates, these were not there, and we were all treated at a very different level. And then we are respected, and nobody used to dare to even talk loudly to the doctors or our professors. Today, things have changed. Consumerism has come. Medicine and medical treatment and hospitals have become business. With the result, we are bound to face the consumerism and the violence. But how we can ward off is a subject of different topic. But then we don't take into that. But then we assume that that is one of the important factors to decide which career I'll take. The aura, just like Lord Vishnu around you, there will be a glow around your head after you become doctor, right? The aura surrounding the medical profession is, it's of the noblest profession. There's no doubt about it. On the globe, if any profession is the noblest, still now and hereafter also, it will be the noblest profession. Esteem and dignity is very much there for a doctor. Even while we learn throughout. Even this, when we are earning, there is learning. Earning and learning are a continuous process in this profession. And another thing is, we say I am practicing medicine. I never say I have perfected medicine, because this is an ongoing practice and keep on improving. So that is the reason we practice medicine, and we never say at whatever level we are that we have perfected medicine, right? An excellent opportunity to be in the service of the needy and the sick. Look at the COVID now. Who is the COVID warrior? Who is the hero now? Of course, who is also the sufferer? Of course, the doctors. Fulfillment and meaning to our life. And there are three things called PEM, as Mihaly says, P is the sort of pleasure. E is the enlightenment or knowledge or empowerment or whatever it is. And M is the purpose for which we are here. The motive or the purpose for which you are born in this world. That one has to be very clear. A decent standard of living, I tell you, is assured to you. Whatever you do, you will not be definitely lagging behind many others in the society. A human touched word adds an intangible sense of humility to you. We know our limitations. We become more humble. Being doctors, we know how to be having the humility and work with different types of patients. So setting this background, let us start, when you are in the MBBS, when you join the MBBS, that means, when you are here, somewhere there, and you will say, no more worries, my life is now settled very well, and down the line, I am going to be a good doctor. That's okay. And then before the sweet dreams, that MBBS 5 to 7 years course, whatever is that, house surgery and all that, then after that start the problem. The first question most of you would be answering is, my friend in software is so well off at the end of 23 years. Why the hell did I study medicine? Some people might think about it. But there is no second thought. You have done that, point of no return, go further and see how best you can use that. One more, jackass. Jackass means a donkey, a laborious donkey working from dawn to dusk with meager return is called a jackass. So am I going to be a sort of donkey or slave-like thing for the next 3 years for PG and another 3 years or so for fellowships and super specialties, studying abroad and all that? Okay. Now, in 1960s, when we joined and became graduates by the around 1968, I graduated. At that time, clinical. All our professors used to tell us there is nothing other than learning the clinical medicine as an art and a science to the best of our ability. True, and clinical medicine still holds a high place. But in 80s and 2000, what happened was the scenario has switched on to imaging sciences. The advent of ultrasound, CT scan, MRI, PET, and name any imaging modality today. We have intravascular ultrasounds. We have so many intravascular procedures. We have so many live radiological intervention procedures. And the imaging science ruled the roost until 2000. From 2000 to 2020, in the last 20 years, the trend is changing towards intervention radiology, intervention cardiology, intervention gastroenterology, intervention hepatology, like that, intervention ophthalmology, intervention ENT. So everything is now interventional. Now there are private medical colleges where we used to hardly have 1 or 2 medical colleges in the whole state as a private college when we joined. But today, the private, corporate and private hospitals, private medical colleges and the government medical colleges are on par with each other in terms of numbers, facilities, infrastructures, intake and everything. Tremendous increase in the knowledge base that we have. And medical knowledge is increasing by leaps and bounds. Every day, thousands and thousands of articles are published. Computers, information explosion, knowledgeable patients. Very important. Beware of that. Patients are sometimes more knowledgeable than what we know about the disease, because he would have at least gone to 10 different doctors and visited 20 different websites and taken around 30 different printouts, because he is dealing with only one disease of his biliary colic. Whereas for us, it's not like that. We have to update everything. Affordability has greatly increased in the population. Tell any test they're ready to take up, but it is for you to decide what to do. New challenges to doctors have opened up plenty of new opportunities, new courses, and there are several learning curves in undertaking those courses and using those instruments. Earlier days, there are only very few instruments, and the learning opportunities are practical opportunities are limited. Today, I acquire a new computer or a new gadget or a new intervention technique. I have to learn through the curve 6 months, 1 year to become expert in that. Clinical disciplines now need the support of many fields of science. Why I said this? All this is to tell you there are openings for doctors to go into these support courses, which may not be the direct clinical courses, but still they will be very lucrative, very fulfilling, and sometimes they give you a sort of escalation in life very faster than taking a clinical discipline or whatever it is. Let us see that a comprehensive outlook of options and the opportunities for medical graduates career after MBBS has become a very important discussion point. Okay, you have to balance this matrix. This is called the career matrix again, from a philosophy scientist come doctor. And the career matrix is, one is the happiness you derive in undertaking a course or doing a program. And the second one is the achievement that you can probably expect in that. And of course, the third is the passion. And fourth is the work-life harmony. What is that? Supposing I am passionate to become a surgeon, whatever may be the other alternatives, it matters nothing. I'll become a surgeon. Likewise, work-life balance means if I'm a sort of woman just going to get married and has to tend the family, take care of the elderly parents and also the children, then probably I should choose a discipline which has got lesser number of taxing working hours, night duties, and etc. Likewise, these have a bearing on what you really would like to choose from the various options. You are all medical students in colleges. Remember, this is a quote from my professor. I always remember him for saying that. He used to say, you are all medical students in this college, but once you are graduates, after that, you are eternal students of medicine. What does that mean? We keep on updating. If you don't update, we will be professionally dead. Now, what are the major paths that we have in India at least? There is a postgraduate course, that is the commonest option is go for a PG. Second one is take a career in medical research. Third one is go for hospital management because there are several corporate hospitals coming up today and they are in place also and they require competent trained managers for that. Or go abroad and do some fellowships or study there. Or open up a shop and then do clinical practice, either a solo practice or in a hospital or whatever it is. And finally, go into central medical services or government services or pharma industry or biotechnology, whatever may be, is your choice. So basically, we will be discussing this any one of these 6 topics there. So PG course, medical research, hospital management, abroad studies, clinical practice, government and central government jobs, biotech and pharma. So these are the options available. We will try and explore each one of them to some extent. Now, when it comes to postgraduate course, there are PG specialty degree programs which give MD or MS, and after that the MD, post MD, BM and MCH, and PG diploma, formal diplomas like DGO, DCH and things like that. DNB is Diplomate of National Board, which is equivalent to MD or MS at the basic level, and then at the specialty level equivalent to cardiology, neurology, DM like that. Okay, and you have informal diplomas. These are offered by Indian Medical Association, Association of Physicians of India, other international bodies offering informal diploma courses. So PG specialties, degree specialties, MD, MS, and then diplomas, formal diplomas, DNB, and diplomas informal. What are those? We will see. So indeed, the most sought after option is PG, post-graduation. Students do wish to do that, and also the sort of the parents also would want to see their wards have the postgraduate degree. That is another important thing. Doctor of Medicine is MD, and Master of Surgery. And today we have 52,715 MBBS total seats in our country, including private and government sector. And Government of India, the Ministry of Health has declared from the next academic year, 15,700 extra seats in 75 medical colleges are being added. So which roughly boils down to 70,000 seats we have MBBS. So, but what are the number of medical colleges we have? 190 government, which have got around 25,000, and then private colleges around 26, totaling to 52,000, and added will be 25,000 in the next year. The total number of MD, MS, and diploma seats in India at the moment are around 44. So out of the 52, 44,000, and there's again private plus the government together 44,000. 36 are the regular programs, 8,000 are the diploma programs, are the DNB programs, including All India Institute of Medical Science, PCI, JIPMER, NIMHANS, and other central institutes. Some of the toughest PG exams in medicine are conducted in India in any one of these national institutes. Even after a lot of trials, one may not succeed. That doesn't deter you from attempting. All the same, it is a question of understanding the concept. Here, what they test you is not the content, but the concept. When you go to the central institute, this one, they don't ask you what is the value of serum calcium and when you call it as low calcium. They're not going to ask you abstract values. They're going to ask you the concepts. That is exactly where exactly you will be able to prepare yourself and cash on that. And I have given you 2 links here. This presentation will be available on the YouTube as well as it will be shared with the like-minded. Just to leave your WhatsApp number there in the chat box, and to all of them you copy the presentation. Then, see, these links will tell you more about these things. because we are not able to go cover everything in 1 hour, does not matter. Still, a lot of information can be passed. 70% of the PG seats compared to the MBBS seats, and may get college of your choice. Sometimes you will not get the branch of your choice. You may get the branch of your choice, but the college that you wanted to join is not available. NEET, is the entry point for government for all the colleges, including private, government, and also for the DNBs today. Earlier, there used to be separate DNB examination. The government of India has abolished those examinations, and they have combined selection for DNB seats also with the NEET examination. There are 3 categories, all of you know, A, B, and C. I don't have to explain more about the NEET for you. The duration of PG degree in our country is 3 years, diploma is 2 years. Great career opportunities are there after completing the PG program. Either you can super specialize, or you can, as a generalist, MD medicine or MS surgery, you will have a very good standing to start off your career. So there are, MCI has recognized 78 PG programs and 61 diploma programs and DNB courses available across the country. These are the gateways, of course, for super specialties. Full details are available at this link, and as I told you, this will be shared with you. NIH is offering a course called National Institute of Communicable Disease, and NICD is offering a course in MPH, Master of Public Health, which will be very, very useful if you are seeking a career as a health administrator or an epidemiologist, or in a research team. You want to be the epidemiologist or a clinical epidemiologist or a biostatistical position. For that, MPH will be available. Now, you can see the whole list of all the conditions. DM courses in infectious diseases, a new entry, organ transplant medicine, and critical care DM, critical care medicine DM, MD thoracic medicine is a new entry, and then sports medicine, family medicine MD, aviation and aerospace medicine, medical genetics. I tell you, if somebody takes aerospace medicine or medical genetics, the career is going to be skyrocketing. But then, because there will be very few people who would have done that. And of course, the number of opportunities available also may be less, but then the rheumatology has a separate MD, and then DM rheumatology is there. Now today, MD rheumatology is there, MSc, Master of Family Medicine is there, MD palliative medicine is there, MD tropical medicine is there, MD maternity and child health is there apart from OBG, emergency medicine is there, MD biophysics for all the instrumentations that you use, like your ultrasounds, your CTs, your PET scans and all that, you require biophysics people. And a Master of Public Health and Epidemiology is there. And transfusion medicine, very important, because transfusion medicine is not only giving blood today, a lot of things are added, including matching, selection of donors, platelet, this one, and even in COVID conditions, if you want to give a plasma exchange, plasma transfusion, convalescent plasma, you require a person who is competent in transfusion medicine. Immunohematology and blood transfusion medicine, community health administration. Geriatrics is a big branch today because most of the people are getting aged in India, and the aging population is becoming bigger and bigger, and in the young, the disease rate is lesser. In the aged, there are multiple ailments, and once they are a patient, they will be a permanent patient, because if she is a patient of joint pain or a heart disease or hypertension or diabetes, she's going to come again and again and again. So geriatric practice is going to be very, very lucrative. And also the mortality in geriatric practice is very well received by the family. Somebody about 80-85% dies, they won't really produce any violence on versus a child of 3 years succumbs to some infection. We have made the scapegoat. So remember that geriatrics could be a very good option. Hospital administration, of course, is the key discipline today, with so many hospitals coming up, and they're asking for not only MBA hospital administration, MD hospital administration, MD health administration, MD lab medicine, not clinical pathology, not MD pathology. There is a lab medicine separately is available, MD nuclear medicine for all the nuclear types of tests that we do, the technetium 99 scans, and whatever you do with nuclear medicine, there is a special aid MD Nuclear Medicine, and Master Public Health, MPH, I told you, NICD is offering, and MD Physical Medicine and Rehabilitation, with so many people becoming sports persons, and there is a lot of scope for physical medicine and rehabilitation in the arena of sports. Now, diploma in diabetology, very useful because diabetes is such a common disease. Every alternate person around 40-50 years is a diabetic. If you do a specialization in diabetology, it will be very easy for you to graft in the practice very fast. Diploma in hospital administration, and then diploma in health administration, diploma in health education, diploma in industrial hygiene. A lot of industries, they are employing doctors as their consultants for the industry on a permanent, also on a part-time basis. If you have degree or diploma in industrial hygiene, you will be the preferred candidate over anybody else. And diploma in immunohematology and blood transfusion, diploma in medical virology, because we do get so many viral diseases today compared to what we were seeing, because at that time viral disease was something very rare, because they were never diagnosed, no one knows what was the viral disease, there were no virology labs, and there is no clinical base for the virology. Here, excellent opportunities for virology, and now apart from bacteriology, now we have a separate degree in the degree or diploma in virology, occupational health, public health, physical medicine and rehabilitation diploma, sports medicine, aviation medicine diplomas, diploma in clinical cardiology. So this is after MBBS. You don't have to become MD and then DM. They are offering you some basic training and then calling you as clinical cardiologist. And you can use this knowledge to diagnose infarctions and arrhythmias or treadmill you can do and all the other things. So diploma in industrial health, diploma in marine medicine, and diploma in nutrition. NIN Hyderabad is offering a wonderful, robust program of diploma in nutrition. Diploma courses usually are 2 years, less competitive, relatively easy to get an admission, non-recognized, of course, for the teaching profession. If you want to be a medical teacher, you have to have MD or above, MS or above. Good to pursue in private practice orientation, a diploma course, and DRM, Diploma in Radiation Medicine, is being offered by the Baba Atomic Research Institute Research Center. Mumbai is offering a beautiful diploma in radiation medicine. And this will be probably the future radiation medicine, because we use so much of computers, so much of artificial intelligence, so many gadgets, and unknowingly there is a lot of radiation injury to all of us, including the cell phones which you are having. And radiation medicine has got a definite role to play. So having said that, we would like to know a little bit about the DNB program. DNB is awarded by a national body called the National Board of Examinations, or NBE, an autonomous body under the Ministry of Health and Family Welfare, Government of India, started in 1995. When we were students, we never had anything other than MD, not even DM was available. And DNB is a boon for those who cannot get into the regular MD or MS program. And this is the advantage here is it is comparatively easier on entry, because this, of course, today now it is through the NEET only, relatively less expensive, and management as per the guidelines. Every hospital goes by a protocol and standard guidelines, unlike in medical colleges where lots of whims and fancies are there. I am teacher in medical college. I know what the treatments that are offered there. It depends upon the individual, and generally guidelines are kept aside and they are not really used. Whereas in a private hospital where DNB training is occurring, no chance. Unless you go by the guidelines, you have to answer in the court of law if something happens. So recognition abroad is as much for MD and MS, this DNB medicine or DNB surgery, or the DNB cardiology, DNB gastroenterology, also equivalent to your DM programs. And another important thing I find is, because I am on the board which selects hospitals for DNB, and we have a set criteria to evaluate whether a particular center is qualifying for a training in DNB. So what we do, you use yardsticks like what equipment they have, and always we insist on a very good state-of-the-art equipment for the DNB training, and also a good library to read, which is a very updated library with all the modern computer facilities are the need for every institute which wants to start a DNB program. So that is a great advantage, and you work with people who are in the field as consultants, not just teachers. Okay, whereas here in the DNB program, the persons who are there teaching you or guiding you, they may not give you lectures and then formal talk, but they will impart the knowledge in an informal way or a practical way. And probably, if I'm given the option, I would choose a high quality hospital to do a DNB rather than an MD in an old medical college, where the infrastructure is lacking, everything is under the thumb of the government, and lots of hiccups in getting things rectified and all that. Okay, what are the disadvantages of DNB? It is low pass rate, because and being examiners for DNBs, we know how tough we grill those candidates to bring them out to a pass level. The pass rate is much lower and less surgical exposure. Because in private care, generally, the surgeon who is operating would not like to give hands-on experience to the student, and they will be watching. Whereas in a medical college, for a surgery graduate, it's always the professor says, let the youngsters do it, let them learn it. Because that's one way they can be a little away from the work also. And problems in private practice also. If you say DNB, people may not understand what it is, versus your friend has put a board, he has got MD medicine, the same DNB, you did DNB and medicine, but then the people may not identify you as equal specialists. And DNB is not allowed now for the teaching jobs. Earlier they were taking, but Government of India has now said, no, we don't want to take DNB people for teaching. They are contesting, and probably down the line, DNB people also will be able to teach. Now, super specialty courses in DNB, medical and surgical specialties, you can go through the list. Cardiac anesthesia, very important area, and then cardiology, clinical pharmacology, endocrinology, gastroenterology, hematology, medical genetics, medical oncology, neonatology, nephrology, neurology, pediatric cardiology is an emerging discipline, because not only the adult cardiology, lot of pediatric cardiology requirement is there in the institutes, and pediatric cardiovascular surgery has become a specialty, particularly for correcting the congenital abnormalities. Today we don't have to open the heart of the child, we have non-invasive procedures to operate on congenital abnormalities. Rheumatology, as a super specialty DM, is available. Cardiothoracic surgery, MCH. There is a direct course after MBBS, 6-year entry. This is there in 4 institutes in India, wherein you can, after MBBS, you can qualify and join the direct MCH course. 3 years for the MS, you get it, and then after 3 years, they give you a double degree, the DNB in this one. DNB, first they give the DNB in surgery, and then they give you DNB in thoracic surgery. Genitourinary surgery, neurosurgery, again a 6-year course is available. DNB, pediatric surgery also, a DNB course is available. Peripheral vascular surgery, plastic surgery, a 6-year course. Surgical gastroenterology, surgical oncology, and thoracic surgery. I tell you, surgical oncology, watch, that is the specialty. Medical and surgical oncology, because we are conquering the infection, we are overcoming the onslaught of all the communicable diseases, barring certain things like COVID, which are new. But then what is coming up is the non-communicable diseases. One prominent thing among non-communicable diseases is malignancy. And medical oncology and surgical oncology are very well paid jobs and well sought after specialties. Now, National Board of Examinations also runs postdoctoral fellowships. And these programs are select subspecialties. These are called the AFNB, Fellow of the National Board of Examinations, and fellowship program is available in the subspecialties that are listed here. You can see this list, and these are called the subspecialties, not super specialties. There is general medicine, surgery, followed by that there is a DM, MCH, and that is super specialty, and then goes the subspecialty in that super specialty. like hand, neck, hand microsurgery, high-risk pregnancy and perinatology, infectious diseases after DM, interventional cardiology, laboratory medicine, transplant medicine, MAS called the minimal access surgery, neuroanesthesia and critical care, pediatric gastroenterology, pediatric hemato-oncology, pediatric intensive care, pediatric nephrology, pediatric ophthalmology, and then reproductive medicine, a sort of FNB is available. Spine surgery, a specialty, is available in India. And if somebody has got a spine, most of my patients who come to Manipal, they will ask, is there a doctor who can take care of my spine? We say orthopedic. No, we don't want orthopedics. We want a spine surgeon. So that is the extent of people's knowledge about the super specializations, sports medicine, trauma care, and vitreoretinal surgery. All these FNBs are available in India. You don't have to go abroad. Of course, you can always qualify from abroad also, but then these are available now under the banner of National Board, which is the FNB. Now, AIMS, New Delhi, SGPGI, Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. If one has gone to Lucknow, they'll see what a beautiful institute. It looks like a palace, and to work there is like a heaven, because all facilities, infrastructure, and the teaching facilities, caseload is so good there. JIPMER down in south, we have a wonderful institute in Pondicherry, in the PGI Chandigarh, and Sri Chitra Tirunal Medical Institute in Thiruvananthapuram is a highly acclaimed institute. All India Institute of Hygiene and Public Health, where I had the opportunity to study tropical medicine for 1 year in Calcutta, is one of the national institutes if one wants to do epidemiology, public health, tropical medicine, and the like. ICMR, National Institute of Epidemiology, is there and right in Chennai. When I was working in ICMR, we were trying to formulate the course materials and all that for the NIE, and that is now in place. And CMC Medical College, Christian Medical College, Vellore is a very reputed college. B.R. Ambedkar Center for Biomedical Research under the University of Delhi is for biomedicine. And St. John's Medical College in Bangalore, JSS Medical University, where I am an adjunct professor, is one of the top institutes of India. It is called now JSS, Center for Higher Education and Research. So Madras and Stanley Medical College in Chennai, and then Seth Govardhan Das, Surendra Das Medical College and King Edward Memorial Hospitals, Jagadguru Jayadeva Muruga Rajendra Medical College in Karnataka are some of the leading colleges in this country. So you can have this list and see whether you can aspire for those things depending upon your performance. Now, this is all about PG teaching. I spent a lot of time on postgraduate medical education because that is the one which you would be willing to do mostly. Then the medical research. If you choose a career in medical research, you must be prepared to be a technologist and also a team player, and there should be passion for innovation and expect less clinical work. I worked in ICMR for 10 years, I knew that the clinical work is very minimal. That's the reason I have left that job. If you don't have a passion for non-clinical, relatively non-clinical work, research is not the career. But if you are okay with that, probably that is the option. ICMR, Indian Council of Medical Research, is the leading organization. WHO, TDR is offering wonderful special fellowships. Tropical Diseases Research Center, which is a branch of the WHO, and there is a Rockefeller Foundation grants are there. Just explore in the net what are the TDR options or Rockefeller options to do research programs in and around or outside India, and also jobs. Very decent pay scales, because the central government pay scales there, and its time scale promotions, international exposure will be there. I at least have traveled to 6-7 different countries when I was in ICMR, and then the publications you get as an added bonus because you're working and you publish your research and your esteem in the society of intellectuals will go up. And then ICMR student fellowships are there for doing graduating, and also there are research grants by the ICMR, short term and long term. NICD, NTI Bangalore, National Institute of Tuberculosis, they have research opportunities. Pharmacological research positions are also there. Some companies do offer some fellowships for doing pharmacological type of research programs. 3-year programs are there which can lead to a PhD at the end, and 45 MCI approved PhD courses. You may not be knowing that. PhD means you think it's only for science graduates, BSc, MSc, PhD or MA PhD. No, we have 45 approved PhD courses after MBBS, and becoming a doctoral fellow, a PhD fellow and doing a postdoctoral in that will be wonderful. But of course, it will not be clinical, it will be more a research type of job. Then medical research in India, we are a little behind compared to other countries, but if people like you take up research careers, certainly it will be a different story altogether. There's an immense need and demand for people who are quality clinicians who are interested to go for research. ICMR, Central Institute of Medicinal and Aromatic Plants, where you do research on the herbal remedies. CCMB, Center for Cellular and Molecular Biology, St. John's Medical Institute in Bangalore, and many institutes like AIMS, PGI, and NIMHANS have got research programs as well, apart from the MD programs. Tata Institute of Fundamental Research has got opening for medical graduates in biomedical engineering and biotechnology. Now, what are these PhD programs? You can see a host of PhD programs starting from biochemistry to nuclear medicine. I'm not going to read the list here. Anyway, I'm going to supply it to you. And these PhD programs are worthy to do because they're as valuable as an MD or an MS. May not be in terms of practice and patient care, but in terms of a career, in terms of lucrative salaries and decent quality of life. And now these are other slide for the PhDs remaining. All these are MCI approved. Limited number of positions, need to identify a suitable guide first, and decent remuneration is provided when you do the PhD. And you, unlike the MD or MS where the paltry return is there for your work that you do, and no laborious work, 24-hour night duties and all that, they won't be there. Direct from MBBS also you can join some PhD programs, usually 3 years, and may get prolonged depending upon your intensity and ability to negotiate and complete the program. There is a beautiful saying that translational medicine, that is, you know, what is happening in the bench, in the lab, you translate to the bedside. So a lot of research can be done from the bench to bedside. And, you know, there are, let's say, for example, we didn't have a test to identify COVID in the first 3-4 months immediately. We were relying on the RT-PCR. Somebody went to the bench and found out a CAR test, which can give the results in 15 minutes, just like a pregnancy test or hepatitis B test. Now the CAR test is very applicable and very useful now. That is bench to bedside. So that's where exactly the research positions are very important. Now coming to the hospital management, very fast developing field, corporate hospitals are there, professional managers are needed today. Today health industry is larger than the IT industry. I tell you, health industry is 3 times larger than the IT industry in India. These are the figures from the sort of national NIC, National Institute of Informatics. Today, several ITES, IT-enabled services are integrated with healthcare. Indian Institute of Management is one of the worthy institutes, but tough to get. You have to go through the CAT, just like any other MBA. You can get an MBA in hospital administration or MBA in business administration. Both are possible for MBBS graduates. They are open. Remember, you may not be knowing that you can go for an MBA program. Basically, you are a graduate. You can go for a master's program, MBA program. There is also MHA, Master of Hospital Administration, only specific for hospital administration, and this is being offered in Dhirubhai by Ambani Institute of Management, and duration of the course is 2 years, no clinical work. That is the only drawback or the plus point too. And MD Hospital Administration is also available. Now, MBA Hospital Administration, what are the institutes which are offering? IIMs, as I told you, and then the FMS in Delhi, and then the ISB school in Hyderabad. one of the most reputed business schools in India is ISB. If you have qualified from ISB, it is equivalent to coming out from IISc Bangalore in terms of science, or even better than IIT. Okay, MDI Gurgaon, XLRI Jamshedpur, XLRI, wonderful facilities are there. I had the opportunity to visit XLRI around 15 years back on a different mission. So this is nice. These are different things are being offered. Now, foreign study, should I go abroad? That's also an option. Okay, but then the intake today in US is much limited compared to when we were graduates. The moment we pass out MBBS, 80% of our batchmates have flown to US. Only 20% of people like me have stuck to this country because of the family reasons and whatever you call your commitment to your own works here and all that. But anyway, this is a USMLE. Some of you are already familiar with that. But remember, if you want to do a program in US, a non-clinical program, supposing I want to do epidemiology, or I wanted to do bioengineering, it's very easy to get it. All you have to do is you do a GRE, and with the GRE you get an admission. Work for 2-3 years, and then get a sort of entry into one of your clinical disciplines also. Some of my friends have taken that route. They entered into a non-clinical program through GRE without going through the USMLE. After going through there, they cracked the USMLE and got into the regular programs. There is PLAB, alternative for USMLE in Europe. You have to pass it in UK. You have to pass PLAB after MBBS, and you have to get a GMC registration. Means PLAB is a must. Again, here also, if you want to do non-clinical things, if you have a GRE score, you can get into UK for non-clinical things without going through the PLAB. New Zealand, Australia, the options are open, but then the nobody gives you a fellowship, highly expensive. If you have a godfather or a father-in-law or a father who can pay for your studies in Australia and New Zealand, wonderful. And New Zealand is one of the most wonderful countries one can visit and live. You know, the number of COVID cases in New Zealand, less than 3 digits. Okay, so MRCP, MRCS courses, these are now available in India, the Part 1, Part 2, and Australian Medical Council, and Fellowship of the College of the Physicians and Surgeons, FCPS, these are different and things. In this MRCP, there are 2 parts, Part 1 and Part 2, and then PACES. So I am luckily one of the trainers for the MRCP, and we can guide you through the MRCP programs. If any one of you are interested, you can start working from here and write the final examination there. And now you have clinical practice and job. So the option is, I have finished my MBBS, I don't want to study, my legs are already aching, I have been a donkey for 6 years, I just want to practice. Okay, this is suitable for people who already have an established practice, like your father-in-law or a brother or father or sister, and join them in the clinical practice, slowly pick up the skills and do it. And not a good idea for a young graduate, because you are in a stage or a sort of life point where you can work hard for a few more years and get better sort of knowledge and skills. So, but anyway, hands-on experience is required. Directly you cannot practice. You have to work with a senior for 2-3 years in a specialty of your choice. Competition with the local doctors will be there who are already established. More worst thing is the competition with the quacks. The quacks usually they don't compete with the specialists. They only compete with the MBBS people because they think that is the comparable level of persons. Generally, patient preferences are low today to seek an MBBS doctor. Earlier, it was MBBS doctor was the king. He was the surgeon. He was the gynecologist. He was the ophthalmologist. He was the physician, and he was the health educator and everything. Diagnostic testing backup in rural areas is a concern. We don't have good diagnostic facilities, and MBBS person without good diagnostic facilities will be without any tools to make a proper diagnosis and win the hearts of the people. So wound clinic, nursing home, hospitals, if one has, okay, certainly you can have a try with your seniors in the family. Now, so clinical practice options, you can have an own clinic or start a hospital, or you can have a solo practice, or group practices. 2-3 of you, your friends can join and start a group practice. Morning one person, another person in the afternoon, another in the evening, and 2-3 different places also. Multi-specialities, you can bring your senior colleagues who have already completed medicine and surgery into that group practice. Some of our friends have tried these things during their careers, bringing people from the neighboring city and trying to get the specialist opinions. It works for a while, but it will not work always. Private and corporate hospitals you can join, nursing homes you can join, but what sort of job they give for an MBBS man in a private hospital? A very basic, more clerical type of all data entries and things like that. PHCs and government hospitals are there, government service is there. ESA hospitals, they are taking people for consolidated salary also, the sort of ad hoc basis. They don't give you a pay structure, but then give you this much 10,000 or 15,000, whatever is the amount that you negotiate with them. And now, what are the jobs I get in the private practice? Junior doctors, resident doctors, consultant, physician. Of course, you have specialty, senior consultant, junior surgeons, medical professors, tutors, researchers, scientists, administrator, medical officers managing the office of the hospital, solo medical clinics, private, corporate, labs, employing doctors as part-time consultants to write reports for them, nursing homes, medical colleges, government and private, primary health centers, pharma companies, and biotechnology companies. So these are various options if you are looking for a job. And now government service, you have to go through the UPSC for the central government, and the state government qualification also, you have to go through the sort of state government qualifying examination. It's called State Public Service Commission, and they have to get enrolled there and pass out, and ultimately will be posted in the rural areas at least for 3 years today. And then we have now the pharma and biotech. You have MTech, biomedical engineering and biological sciences. MBBS graduates are being taken in for an MTech program in biomedical engineering and biological sciences. MBBS graduates an option for MTech offered in IITs to pursue their careers in inventing medical machines, developing medical machines and instruments. Masters in Medical Science and Technology called MMST. It is also offered by IITs, deals with bioinformatics, medical biotechnology. Bioinformatics is, how you sort of keep the data that flows out from the patients, and how best this data can be generated first and then compiled and then analyzed and used for research and used for interventions. Medical biotechnology, healthcare imaging also. These are available in IITs. Of course, you have to go through the JEE entrance to get sort of selected for those things. Now, ultimately, the nanomedical services, and you have Amrita Institute of Medical Sciences under Amrita Kochi, Amrita Institute AIIMS Kochi, Kerala is offering total 20 seats are there, medical nanotechnology and nanomedical sciences. Program is fully funded by the Department of Science and Technology. You get a very decent scholarship. MBBS, MSc, BTech, MPharm, BDS, all are eligible to join that. Selection by entrance test and by interview, and not by your JEE or not by your GATE or anything, or not by your other test there. And Shastra University, Tanjore also offers MTech in medical nanotechnology. So if you are really wise, you catch hold of some of these newer disciplines and skyrocket your career. And finally, the paths less traveled. I'm going to close with this slide. Civil services, IAS, IPS, IFS. I know many doctors who have taken to this route, IAS and IFS. If you ask them the satisfaction level, it's a mixed reaction. Some say okay, some say they're not happy because they don't have any clinical thing. But you work in as health secretaries and contributing to healthcare decisions, very useful. If somebody is interested in that, armed forces. If you go short service, permanent service commission, nothing like being a doctor, and that too nothing like being a doctor serving in the army. Because you have a service to the society and service to the most essential part of the society, the army. Non-USMLE, GRE, PhD, MPH programs, jobs in the high commissions. What are these? Let us say there is an Arabic UAE High Commission. They offer very decent salaries for people to screen all the persons who are entering the visa applications and things like that. And they are the High Commission jobs. Health insurance sector. Today, health insurance is a big business, and they want doctors to decide whether a particular claim is worthy in terms of medical opinion. So they're employing doctors as health insurance specialists there. Medical publishing industry is a beautiful industry. Now, so many new things are being published. If you are a doctor, you can tailor the publications in such a way that it will reach your target audience, the doctors there. Medical transcription. Somebody dictates in the US, the files come here, and then our sales team. I know a friend of mine who has taken to medical sales job. He sells ultrasounds, and then he sells X-ray equipment, he sells CT scans and all. He is a medical doctor. So these are the paths less traveled. Now, you please download this Android app called Plexus MD, and there is a link also there. This Plexus MD has got numerous guidances for you to churn through what is available for you so that you can decide. This is an app on the Android as well as in your laptop you can install. Now, these are the various resources which are available. This will be shared with you. Whatever I could not pass on to you, more information is available on this. Around 10 to 12 different resources are listed. You can use these resources for the best advantage of you. Now, of course, yours sincerely, the person who is talking to you, is already available for you in his website, in his mail ID, and also through the YouTube link for doctors. You can use I have several YouTubes. This one is for medical doctors. So use these links. My website, drserma.in. Mail ID is srma_rvsn gmail.com. And my YouTube link, Dr. Sharma Ji. My student has started it. So he called me as G. DRSRMAGI, you type, automatically you get the YouTube link to know more about what is published and what is present in my YouTube channels. Now, of course, this program is arranged by Taxila Medical University. Taxila is doing a women's service for medical profession by offering various programs. And this Taxila American University is a fellowship program, a master's in medicine and surgery it is offering with training in the Royal College. That is where I come as a faculty for them in the Royal College training group. And then they have specialties like internal medicine, general surgery, radiology, pediatrics, obstetrics, and gynecology. How you can get into Taxila's program? You can use that link or contact the organizers here who will be able to tell you more about Taxila Medical University and their programs. So my given time is 1 hour. I used 55 minutes. So to be a good professional, I would like to close a bit early so that you people can have some interaction. Type your questions in the chat box. Sanyukta can moderate the question. She can read the question for the benefit of others, and I will be able to give the so-called answers, whatever I know. If I do not know, I will refer you to look into some of the resources, or I myself will be able to explain to you at a later stage. Please reach us in the contacts I have given you. Thank you very much.
Thank you, Dr. Sharma. Thank you for an amazing session. Before we could move to the question and answer session, I would like to request the participants to take up the polling session. Dear participants, polling has been enabled for you. Kindly take up the poll before we could move into the question and answer session. Dear participants, kindly take up the polling session so that we could move into the question and answer session. Also, If you have any queries, kindly post it in the chat box so that Dr. Sharma would be able to answer us.
I see here there are three messages in the chat box and 2 in the QA. You can open them and start opening that and then answering those things. I'll answer.
Moving to the meanwhile, who have not taken the poll can take up the poll. The first question is that what is the role of basic medical sciences to the mother doctors, those who want to take care of house and office?
That's what I said. If your priority is to spend more time at home for reasons that you have explained, like being a mother, she will have a lot of responsibilities in terms of kids, elderly people, the husband, and if she goes for a 12-hour hospital cardiology job after DM cardiology or a surgical job or an obstetrician and gynecologist, she will be always on toes. She will not be able to really do the work-life balance. So if one wants to have more time available for the family, I would suggest they go for some non-clinical specialties like biochemistry or bacteriology, virology, where you go for a structured number of hours, 10 o'clock to 5 o'clock. And sometimes you can even be able to work from home, unlike a clinical person. For example, if I'm a cardiologist, I have to go and see the patient. Without seeing him, my job doesn't get done. And if I'm a surgeon, there is no way I can do it from home. So certain jobs make you have to be on the spot. Suppose there is a plumber, and if he has to come to the spot to do the plumbing, he can't do an online plumbing. So like that, we have to decide. And certainly your suggestion, Dr. Gauri Shankar, is well taken, that people who want to have a lighter work in their career, particularly women doctors, probably non-medical science, non-clinical sciences would be a good choice.
Thank you, Dr. Sharma. We are moving on to the next question. The next question is, sir, after MBBS, directly, can we enter into research?
Yes, that's what I said. You can take a PhD program and work for a degree, or you can join a research institute under a guide and work for a research. It might lead to PhD if you are doing that, or you can still have a research career, and then you are taken as junior research assistant. JRF, they give a fellowship to start with, JRF, Junior Research Fellowship, then you will be a research officer, then after some time you will be a senior research officer. The starting position will be Junior Research Fellow, JRF, with MBBS. If you have MD, you can join as SRF, Senior Research Fellow.
Thank you, Doctor. Moving on to the next question. It is, hello, sir. Out of the given options over the lecture, what is, in your opinion, the best choice looking over the recent scenario?
Very difficult. As I told you, there are 4 things: your passion, your interest there, and your interest in clinical medicine, all this way. But you know, at the end of the day, if one becomes a doctor, one wants to have the stethoscope and then do the clinical work. Anything less than that will be, sacrificing a bit of the so-called glory of the medical profession. Having said that, if you choose a career in biotechnology, no cardiologist can come near to him in 10 years. I tell you, if you do IIT biotechnology after MBBS, you will go elsewhere in the whole world. And I know my friend, I have become, what I am now. My friend, he after MBBS, he went to US and he did a program in medical research for 3 years. After that, he went into a medical technology job, and he is one of the topmost technological consultants in medical intervention machines. It all depends on how it takes up. But my preference individually would be to be a clinician, either a surgeon or a pediatrician or a gynecologist or a physician, and above all, nothing like general medicine. I tell you, it gives you an overall view of all the diseases, and the vision is never tubular, and always the subject is expanding. So you have new things to learn in MD medicine.
Thank you, sir. Moving on to the next question. If something I have to choose between PG in India or going to abroad and do my studies, best option can be?
Okay, if you want to do a PG in India, you know our bottlenecks, you know our exams, you know how stringent are they, the reservations and all that. Once you cross the boundary of our land, this reservation thing will go away. Okay, that's a great plus point for everyone. Having said that, you should have enough finances. Every university which offers you a program in the Western countries expects you to fund yourself during your post-graduation. Funding means not only eating expenses, the tuition fees are enormously expensive. And after going there, majority of them, they settle in some sort of sundry jobs, research assistant, earn few dollars and use that to fund their programs without depending on their parents. And lucky few will get fellowships also to start off. And that's the, if you have money and you choose a country which is outside India, and I tell you, working abroad, the work ethics, the environment, the learning capabilities are way beyond what we have. Having said that, again, there are a lot of distractions also there which could pull you down after going there. And you never have a bent of mind of returning back once you go there. I have been in India and abroad also, and I know if you are committed to work for your family and for your people around you, nothing like being here. That gives you a tremendous amount of fulfillment at the end of the day, that as an individual, you could contribute to your family and to the people around, and the government which has spent a lot of money on you. My brother is in IIT, he went abroad, and how much he is useful to India, he only has to question himself.
Thank you, sir. Moving on to the next. Sir, when should a student start his or her medical PG preparation?
Right when they're in the final year.
Okay.
But what happens is in the final year, we are more bugged with the examinations, the by-hearting, vomiting, those things in the exams and all that. But in the house surgeoncy, we, after 5-6 years of hard work, we feel like relaxing for a while. And that's it. Once you lose the tempo, you will not get it back. So keep it on from final year itself and intensify it during your internship. Internship is the right time where you can mix of, a little bit of time is available and you are not burdened with any examinations at the end. But a lot of clinical work also will be there. So you can use some questionnaires or forms, but to write your case sheets and keep on ticking them, which I used to do. You get a lot of time available instead of writing each one, this patient is so and so admitted, aged, all that I don't have to write. Just there will be boxes will be there and such sort of proforma are available and you can start adopting, and your seniors also will like you to document like that. So house surgeoncy and final year will be the right time.
Thank you, sir. The next question is, can you give some tips to crack NEET PG? Any tips for preparation for NEET PG or any other entrance exams?
See, what is happening is today's examinations like NEET and JEE for IITs, JEE I don't know much. The NEET examinations, they are more asking you to remember things, testing your memory. Memory skills are tested, which is not right. If you ask me the concept of a particular problem, it will be easy for me to understand and explain, rather than if you ask me to narrate or then verbatim reproduce certain things from somewhere. But having said that, these are objective questions, so that shouldn't be a problem too much. But All India Institute of Medical Sciences and NIMHANS and all, their question papers are entirely concept oriented and not on memory oriented. So depending on what examination you are taking, if you are memory oriented technique, and you have to tune to that, most importantly, go through the last 5 years of question papers, which I always advise. And the question banks are constant. I generate question banks for internal medicine. I know what sort of questions are there in the question bank. We keep on generating questions, and then questions are added to the question bank, and by randomly they pull out those things and then present it as an examination paper. So what is important for us to know is, if you do at least 5 years of question papers, You would have seen the pulse of the questions, and also most of the questions are repetitive. So the idea is to crack previous question papers correctly. If you don't do it well, do it second time without seeing the answers, and you will be through.
Thank you, sir. Moving on to the final question in the Q&A box. Can a doctor participate and be useful as a guide to engineers in their medical research like brain-computer interface, driverless technology, etc.?
Yes, certainly. If you do nanotechnology, if you do biotechnology, if you do BTech medical engineering, certainly they will look forward for you to help them, because they don't know the anatomy, physiology, biochemistry of the human body, and you will be a very good resource person. In fact, a doctor's technologist will be a centerpiece in anything that they develop in terms of instrumentation. And those careers are, these are paths less traveled or frontiers unexploited. And newer graduates, I think they should always look for them rather than looking some MD DM cardiology or something like that. Another important thing I wanted to tell you is, if you do MD medicine or MS general surgery or DM cardiology or neurology, you see only the stars that are there in the field and assume that you will be one among those stars. But the success rate to the topmost position or being very well recognized, very well off intellectually, financially, and fulfillment wise, very, very less, 5 to 10%. Remaining are mediocres. We only look at the stars, we look at Tendulkar, and we wanted to become a cricketer, assuming that I also become Tendulkar. Sure, some of you can become, no doubt, but then everyone cannot be a star. The stardom is not only associated with your capability and capacity, several factors have come into play when you have to really get to the topmost position in any one of the fields that you choose.
Thank you, sir. Moving on to the final question of the day, it is, hello, sir. Thanks for such elaborate presentation. I'm a final year student. Could you please give some advice on how to go about the MRCP process or directly get into one of the 4 royal colleges?
See, MRCP program in India is offered part 1, part 2 and PSS. So first of all, you can qualify yourself from part 1 of the MRCP, and there are recognized institutes in India, just like the DNB institutes, which are recognized by the MRCP for training. So what this is not through the NEET or anything. This is you have to apply through those institutes, and of course through the Royal College, and one of the institutes should be willing to take you for the MRCP program, and the Royal College should approve that approved institute, and they start working with the consultants there and write part 1 and then part 2 abroad and places. And Taxila Medical University is a good source to get into this MRCP training and then aspiring to become MRCP holders. MRCP, I tell you, is valid all over the world. You are MD, US, if you go, you have to again do the residency. You are not called a specialist anymore. With my MD medicine, I go there, I have to do a residency in internal medicine, then only they call me a specialist. Whereas with MRCP, you go, Gulf just absorbs like a sponge, any MRCP or FRCP. So if you try and get those degrees, it will be very nice, and use the resources that are there in the Taxila and as well as other links that I have provided, and you will be able to go through that. And if you have any doubt, any guidance, please reach me.
Thank you, Dr. Sharma. Dear participants, if you have any questions further, you can contact Dr. Sharma through the links given. Thank you everyone for joining the session, and thank you, Dr. Sharma, for an amazing session today.
If you know the mobile numbers of the people who joined today, you can post this presentation to them. And I advise all of them to leave their mobile numbers in the chat box. Whereas Sanyukta can take note of them and copy this presentation to them. It will be a ready reckoner for them. I'll share the PDF with you. I have already shared the PDF with you.
Yes, yeah. The recording of the session and the PDF will be shared with all the...
Available, maybe another 1 hour later, the recording will be available. And there's nothing much to edit because everything has come out very well. So maybe we would just give away this recording just like that. Finally, I thank the Taxila Medical University for organizing this webinar and bringing people to listen to me. And I will be very happy even if a couple of people are benefited by these inputs.
Thank you, sir.
Thank you very much. Shall we stop the recording?